I think.
Hi, my name is Kristen here at the Center for Plastic and Reconstructive Surgery, and we have Lisa Metler, our new physician assistant, who's going to be injecting Liesl with lip filler. So today she's going to let us know the differences between different types of filler, what to expect, and then we also did get questions submitted ahead of time just about filler and things that can happen during the treatment. One thing too, Lisa, before we get started, some people just wanted to know the difference between Juvederm and Restylane filler and what is used for an area such as lips.
So actually the product that I'm using today is called Vobella. It's a Allergan Juvederm product, and it's FDA approved for the lips. Also for the lips for volume and also for periareolar lip lines. All of the different types of hyaluronic acid fillers have a little bit different cohesivity, molecular weight, and I sort of choose which hyaluronic acid or which filler I want to use depending on what the concern is. So today she doesn't need a lot of volume and she doesn't really have a lot of perioral lines here. So I'm going to use Vobella on her. We've already cleansed and numbed her with some topical numbing. This also has some lidocaine in it, so it also has some numbing in it. And she's never had lip filler before, correct? So we're going to get started. I'll get started and we can answer questions as we go along. So as far as ratio of lips, a typical ratio we like is a 1 to 1.6 ratio, where the upper lip is 1, the lower lip is 1.6. I tend to prefer a more natural look with lip fillers. I know one of the questions that was submitted talks about a duckbill lip. I actually prefer to not do that. I don't think that's a very natural look, and so we can talk a little bit more about that as I get started.
So someone usually always wonders if the injections are painful at all.
Mm-hmm. Good.
So are these fillers formulated
How'd
with
that
something
feel? That's fine.
to help with pain?
Yes, as I said, this has a lidocaine in it, which is a numbing. How does that feel? It's fine. Okay. Like a pinch? What would you rate it on a 0 to 10 scale? 0, no pain, 10, a lot of pain.
Like a 5.
Okay. Alright, and I'm just going to add a little more volume right here. Good. And you can see that's already given her some volume here. Hyaluronic acid is a naturally occurring sugar. It's very hydrating.
Okay, numb this side. Do I need to numb it?
You can put some ice on there, yeah. And then I'll just have you hold over here. And then I'll trade you. And this product is actually FDA approved for 12 months, which is a really great thing.
So is there any things she should expect after filler, or is there any downtime that she needs to be aware of?
Well, the good thing about this product is it has very little downtime. Because of its low affinity for water, you tend to get a lot less swelling with this versus some other fillers that I've used in the past. So downtime is typically, a little bit of swelling, numbness the day of. I give people instructions afterwards to not do any vigorous exercise, usually avoid alcohol, salty foods, but other than that, I tell people don't touch your lips a lot the day of the filler, and I tend to get a lot less swelling.
So we also had another question. Someone asked if the lips feel stiff after the filler has settled, such as puckering or drinking through a straw. Does it make it a little bit more difficult, or?
If you do have swelling, once the swelling's gone, you really don't have a lot of difficulty with feeling lumps or bumps. Sometimes you could feel bruises that may last for a week or two, but other than that, this is a very soft substance, and you really should be able to feel it. Doing okay?
Mm-hmm.
It's usually the first injection that's more of a pinch than the rest of them. Once the lidocaine gets in there, then it's pretty numb. And I think that looks like good volume for the upper lip.
So is it possible to have a bad reaction to filler at all? And if so, is it something that can be reversed?
So there's always risks with every procedure. There is a risk of having an infection or difficulty with what we call a hypersensitivity reaction. Those are all things that can be reversed or dealt with. If it's something as far as somebody gets injected with a hyaluronic acid filler and they don't like the look of it, there's something called hyaluronidase that we can inject that actually dissolves the filler. So that's an option there. I think that looks really good. I'm going to add just a little bit more, and then I think we're done in this upper lip. Things feel pretty numb now.
Mm-hmm.
Just to make sure everything's smooth here. How would you describe that? The injections.
This feels fine.
All right.
They look awesome.
Thanks for tuning in.
Thanks so much. Call with any questions.